I met Beth in 2015. She came to me and was having cramping in her right leg, mostly in the calf. When she walked, certain distances had been bothering her for a few months. We did an ultrasound, diagnosed her with peripheral arterial disease. She had a high-grade stenosis, which is a narrowing in the artery. She came in and we did a stent in her artery. It's an outpatient procedure where we go in with a needle and a catheter, and we're able to fix the blockages as we find them. She went home, and I've since continued to follow her every 6 months. And while I was on maternity leave, she was able to get her other leg fixed by my partner, Dr. Vogel, and she's doing really well.
My name is Beth Hainline. I have had the pleasure of using both Dr. Barker and Dr. Vogel. My first surgery, I had to have a stent put in my right leg because I was having trouble walking. So because of circulations, I needed a stent. Dr. Barker performed that procedure. Then I needed another one because it was happening in the other leg. And Dr. Barker was on maternity leave, so I was privileged enough to have Dr. Vogel. So I've had both of them.
So I first had the pleasure of meeting Beth when my partner Dr. Barker was on maternity leave. Beth was initially seen for her routine follow-up by one of our mid-levels, and her study showed that she had some narrowing in the left leg. Dr. Barker had previously treated the right. Beth's big thing is that she likes to stay active and really likes to dance. So then I met Beth in the office because she's pretty selective about who takes care of her, and wanted to make sure she met me before the procedure. When I met Beth, she was initially a little bit hesitant about having something done, and wanted to wait for Dr. Barker to be back. But with Dr. Barker being on maternity leave, possibly for a couple months, eventually she was willing to let me intervene on her left leg. So we are fortunate enough to have our own surgery center, and we took Beth out there and did her procedure. She did very well. We cleaned out the artery, cutting out some of the plaque with something called atherectomy. Did a little intravascular ultrasound where we can see the actual inside of the vessel, see any areas that may need further treated, and she ended up with a little short stent. Afterwards, she recovered well, and she is back to seeing Dr. Barker for her routine follow-up. I do a lot of work on peripheral arterial disease, and Beth is just one of our very many patients that is fortunate enough to be in our really state-of-art procedure rooms out at our surgery center. We have really tried to change the paradigm of treatment from being in a hospital where you have to come in several hours ahead of time. You have your procedure done, who knows what you're delayed for in case if there's an emergency, and then you have to recover for an extended period of time, usually in the hospital. We have our system down to the patient shows up about 45 minutes before the surgery. The patient has their procedure. Beth probably only took about 45 minutes. And then she was headed home within about an hour after her procedure. So we've really streamlined the care and actually enhanced the patient experience while providing them with as good, if not better, care.
Perfect job. I'm very, very selective when it comes to my doctors. Not everybody gets to touch this. So I highly recommend them, or I wouldn't be here. And I can still dance, so what does that say?